We've got a lot of injuries heading into the playoff weekend. Let's go now to the hotline. It's time for the Pat and Aaron Injury Report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. Fan favorite, Dr. Jeff Sellman joins the show again. Dr. Sellman, how are you? Happy New Year.
Happy New Year, new you, new year.
New me, new year, new Antoine Winfield Jr. We'll have to find out. He's been dealing with a sprained knee. He's been dealing with this for over a month now, early on in December. Without a setback, it seems like he's going to be good to go on Sunday. How concerned should we be? Do you think we'll be able to see the guy that we've seen in the past? What's he going to look like, Doctor?
Man, I think he's going to be good to go, even from the very beginning. Would suggest that it's very mild, and then he was back at full practice yesterday. So, he's dealt with that ankle injury on the same side this year. He came back full strength. I have confidence in him that I don't think you're going to be able to see much difference in him in terms of his outcome.
We had talked about suffering multiple leg injuries on the same leg and how that could impact one or the other when it comes to recovery. Do you think that's why what had happened earlier in the season with his foot and ankle that led to him being out as long as he has been out with this knee injury?
So I think that has a huge part of it because it is on the same side. That entire chain of muscles, tendons, nerves kind of all get affected as well, kind of opening the door a little bit for that particular knee injury. But, he can continue playing, so I'm confident that he'll be able to come back pretty hardcore.
Where would he be most hindered by the sprained knee as far as his mobility and things he would do on a football field?
Usually it's the side to side, straight in the front, just running straight ahead. He will probably be good. Explosiveness will probably still be good. He might be a little timid those first few plays side to side when he's thinking about his knee and not thinking about the play in front of him. But, I think he'll be able to get over it rather quickly.
We haven't seen Jalen Hurts since December 22nd. He is still in concussion protocol. We saw this earlier in the year with our own Luke Gedeke, where it took him a while to return from concussion protocol. What do you think is, and we've asked this before, but what is the difference in what you see in a concussion when a player is able to get back in a week or less, right, where they're back for the next game, versus when a guy misses multiple weeks, as Jalen Hurts has and Luke Gedeke did earlier in the year?
The main thing that you see are the symptoms, because with every concussion, it's one of the most difficult sports injuries because you can't see it, you can't touch it. You're just assuming, and you're really relying on that particular athlete to tell you exactly what he is feeling. And if they have, a few symptoms rather early on, then they're in the protocol and moving along the protocol quickly. But if those symptoms continue to persist and you're really trying to get them better, then the protocol will last a little bit longer. You also have to, consider that the end of the year, you want to save your great players. And if you're already in the playoffs, then heck, just keep them in the protocol until playoff time.
Pat brought up Luke Gedeke, and I think it's a good point. Some of these guys will come back for practice, but they still won't be cleared, and that's kind of what's happening with Jalen Hurts right now. Has not cleared concussion protocol, but he's back at practice. That doesn't make any sense to me.
Oh, because each step of the protocol, you advance what they're going to be able to do. So, being a part of the team, number one, I always want my concussion athletes part of the team. So get them on the sideline, on a stationary bike, walking around. And so that could be part of being a part of practice. And then the very next to last step before complete full recovery is some football-specific drills. So you're going to want to do that with your team, and you want to kind of participate in the practice that you're able to participate in.
I saw Tua Tagovailoa. He didn't play last week, but I saw him on the sidelines, and he was wearing those thick glasses. I'm assuming that's to protect his eyes from the light.
Yep, and also there could have been, so you have these conditions with your eyes when you get hit in the head. They start to shake back and forth, and that can help cause you to get a little bit dizzy, a little bit blurry vision. So those glasses kind of help protect the eye and the ability to see.
He's got to quit. I mean, when you're walking around looking like you're wearing 90-year-old glasses on your eyes because your eyes are shaking violently, you got to call it quits.
Yeah, those are equivalent to the BCGs, the birth control glasses we had in the military. You just want to steer clear of those guys.
Yeah.
So let me ask you this, and my apologies if you're not really sure. How was the concussion protocol developed? Has it changed since they first started to implement it? How has it changed? And what are they looking for within the protocol? Like you said, that, there's different stages along the way. What are they looking for throughout those stages? And again, if you know, how was it developed? How did they decide this is the best way to decide if a guy has a concussion and when he's over it?
It's developed through a huge international conference, which, of course, much smarter than myself. The Vienna conference back in 2016 that probably was prompted by the 2015 settlement with the NFL, where neuropsychologists, neurologists, sports medicine doctors all came together, collected all the research, and then spewed out these particular 5 steps that the NFL has instituted, and pretty much every level down from the NFL have instituted. And they have remained very same steps since about 2015, 2016 in the NFL. The things that have changed with the NFL are the rules changes, the helmets they're trying to improve for position specific and covers for the helmets, and of course, counting the number of head hits from AI-generated technology.
Did you just reference the Vienna conference from 2016?
I did.
That was really good. That was really good. I didn't have it on my list, but David Montgomery, how is he able to come back? We were told he was going to be done for the season. I don't know how much you've been tracking that. It wasn't on the list I sent you, but he's been dealing with the ankle injury. How's he able to get back so fast?
Without being a part of the team, you don't know. You just assume that it was not
it was my bad, knee injury.
Yeah, not a very severe injury itself, but being able to progress through their return to play with a knee injury is supported by all the group around him with physical therapy and all that kind of stuff.
We're going to be without the Ravens it sounds like Zay Flowers with his knee issues going into the game against the Pittsburgh Steelers. When it comes to having a knee injury and that, when it comes to your stability within your knee, how much more important is that for a guy with like electric speed, or how much is it more dangerous for a guy that moves that fast when you have a knee injury?
Yes, to all of that. And, the biggest kind of blockage for people and for athletes, especially to come back, is fear. It's psychological kind of roadblock. But looking at his mechanism of injury, holy crap, he got hit twice, once in the ankle, once in the knee, opening up that knee that can cause instability and having effect on that explosive power that he is known for.
Jordan Love's dealing with an elbow injury. Jalen Hurts with a concussion, like we were talking about earlier, and the finger issue. Who do you feel more confident is more healthy going into this game?
Jordan Love. I'm going to go ahead and put my put on that one.
All right. And Christian Watson, he's going to be out for the season. Real quick to wrap it up, torn ACL. I'm guessing that could impact his timeline for next season as well.
Oh, man, you're guessing so right.
Thank you.
Because that's what I do. 9 to 12 months is what we expect. So if he gets the surgery today, he will be back in October at the best case scenario. Wow. January at worst case scenario.
Wow. And before we let you go, I'm just going to ask you a million things. I'm going to drain you dry. Chris Godwin.
I'm already drained.
I was going to say, that sounded weird. Chris Godwin,
you're draining me.
Would you be shocked if Chris Godwin gets back, if that ankle's drained enough to get back out onto the field at some point if they make a long run?
No, I think even the playoffs, it would not be shocking at all to get him back in there. I think he will contribute even with some kind of residual pain from that particular injury. That was rough.
Well, I think Bucs fans, just on that alone, that's the perfect way to go out, Dr. Sellman. The Pat and Aaron Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule that appointment today at floridaortho.com. Great stuff as always, Dr. Sellman. We'll talk to you later.
See ya.
Thanks, Doc.
He's the best.
Bye.
He really is.
He's the best.
On the Bartow 4DA text line, a doctor that's a goon. Cool.
I sent him a bunch of questions before, and some things pop up. The Montgomery thing, that just popped up. You asked him about concussions and going all the way back, and he referenced the Vienna conference of 2016.
Guy's a genius.
He really is.